We will frequently recommend PET scan in order to evaluate nearly the entire body. The PET scan is not really ideal at picking up on malignant changes in the brain, but it does a very good job from the base of the skull down through about the mid-thigh. It's a nuclear medicine scan, and so it is done in the radiology department. The machine itself looks a lot like a CT scanner, just a little bit more width on the donut-shaped hole that the patient has to go through. The patient goes fairly early for the exam and has an injection, usually into the hand or the low arm, of a glucose solution that's tagged with a radioactive nuclide. The PET data, the positron emission tomography data, is always combined in the way that we utilize it with a CT scan. The CT scan gives us the anatomic and structural information, and by looking at these together, then we can isolate the areas that have the increased uptake of the glucose. This material has to get into the tissues, soak into the tissues, basically through regular metabolic activity of the body. So what they'll do is they have you rest in usually a quiet, comfortable chair. They attempt to not ask a lot of questions so that you're not using your vocal cords and the muscles of the mouth and throat very much, and prefer that you not walk around and use other muscles, because anything that's taking in more glucose is going to show up on the PET exam itself.